Now to the effort to vaccinate Oregonians. Today, the governor and the health authority laid out the next group, 1B and beyond.
And the state now has a plan for when every Oregonian over 16 will be able to get that first shot. On March 29th, the state will open Group 1B, and that group will include those 45 to 65 years old with one or more underlying health conditions and some frontline workers like seasonal migrant workers, as well as those displaced by last year's wildfires and those experiencing homelessness.
Then, no later than May 1st, eligibility is scheduled to expand to other frontline workers and those 16 to 45 with one or more underlying health condition would be eligible. On June 1st, the general public, 45 years old and older, will be eligible. The July 1st next group essentially is anyone over the age of 16. So that's the date that they're shooting for to get the general population vaccinated.
Yeah, a lot of new information coming out today. Fox 12's John Hendricks joins us now after speaking with the governor today. And John, she and the OHA, they believe this timeline's going to work.
Yeah, so this all depends on the rollout and how that should work, depending on the number of doses the federal government will be sending. They say that they are anticipating an increase and expect to open up a vaccine to anyone who wants one by this summer. As more and more people become eligible to get a vaccine, the state of Oregon says more doses are on the way, but they are making good progress with the doses the federal government has sent. Over the last week, Oregon averaged over 20,000 doses a day administered. More than 500,000 Oregonians have received at least a first dose. That's 14% of the state's population. Oregon Health Authority Director Patrick Allen said today if Oregon's weekly prime doses increases to 200,000 a week starting in March, Oregon would have enough first doses to vaccinate 70% of adults by the end of April, all adults by the end of May 2021.
Again, these projections depend entirely on our supply. But the good news is that not only can we achieve the timelines the governor announced, we may be able to move them forward. But until we see these doses show up in the ordering system, we're going to continue to take a conservative approach.
The Oregon Health Authority says that they surveyed vaccine sites and learned that they can administer more than 3 times the amount of doses that they're currently doing if they have more supply. The issue in the current rollout of seniors has been limited supply, which in turns limited doses and limited appointments. What will help boost numbers, the state says, expanded distribution points and more locations at retail pharmacy, outpatient clinics, and other hospital sites.
These sites will help loosen the bottlenecks people are currently experiencing as the crushing wave of demand swamps the limited sites we have available to offer restricted supplies of vaccine.
Allen says by the end of March, the state will not only see a dramatic expansion in supply, but the type of places people can go to get vaccinated. A big change coming next week for the Oregon Convention Center. It will be invitation only. More than 40,000 attempts were made on Thursday to try and book an appointment. Now the site will utilize the state's getvaccinated.oregon.gov website to reach out to schedule an appointment.
The scheduling function that is the biggest challenge. And so that's why we're making the switch to a by invitation scheduling function so people don't have to feel like they're trying to win the lottery.
This new way of scheduling things is for the convention center right now. The PDX Red Economy lot site will continue its online schedule release on Monday. If you had an appointment, you will not be impacted by this change. Pete, Nora.
Now, John, I know you listened in on that press conference with the governor. When we talk about underlying conditions, what does that include exactly?
So they're going to kind of go off of what the CDC is saying. So things like type 2 diabetes, cancer, heart conditions, COPD, and obesity as underlying conditions. Oregon is not including smoking as an underlying condition, but is including those smoking-related illnesses. Pete, Nora.